Dear audience, let me introduce myself. I am Benjamin Skribek, and I would like to tell my PhD thesis, which is the significance of minimally invasive interventional procedures, therapies, which effects in the treatment of various diseases. My supervisor is Ákos Pál Deák, and my scientific methodology supervisor is Anett Szabó. We have a vision that minimally invasive procedures will be readily available solutions in the treatment of multiple diseases. Our mission that we would like to simplify the treatment of patients suffering from various diseases, especially tumors. Our aim is to launch novel, humane, effective and safe therapies in Hungary. We have two specific ongoing projects. The first is investigating the efficacy of minimally invasive interventions versus laparoscopic in the treatment of benign adrenal gland tumors. The prevalence of these adrenal tumors are really high. It's about 5% of the tumors. These tumors have clinical consequences. For example, high blood pressure, hypokalemia, constipation, diabetes, and other organ failures. The gold standard therapy is laparoscopic adrenalectomy, but laparoscopy has many disadvantages, and sometimes it cannot be applicable therapy. Because if the patient has anemia, cardiopulmonary diseases, or has previous abdominal surgery, the LA can be contraindicated. Laparoscopy has prolonged postoperative hospitalization, which is 3 and 4 days usually. But we know other therapies, for example, minimally invasive therapies, embolization procedures, mechanical, chemical, and thermoablation techniques. These techniques have reduced interventional duration, decreased perioperative blood loss, and less postoperative hospitalization, usually 1 or 2 days, and has faster recovery time. Our aim is to compare laparoscopy and minimally invasive procedures in the treatment of benign adrenal gland tumors. Our clinical question: are minimally invasive interventions safer and more effective therapeutic options for patients with benign adrenal gland tumors than laparoscopy? We use the PICO framework. We examine the patients with benign adrenal gland tumors. The intervention is the minimally invasive procedures with laparoscopic adrenalectomy. We had primary and secondary outcomes. The main outcomes is the complication rate and the success rate, which is a biochemical rate. Our secondary outcomes are the operation type, postoperative recovery, perioperative blood loss, and postoperative pain treatment. We hypothesize that these minimally invasive procedures are safer and more effective options than laparoscopy. We used the systematic search key in 5 databases, and after the selection process, we had 5 eligible full texts. As I mentioned, our first primary outcome is the complication rate, and in terms of our statistical results, we can determine that the laparoscopic adrenalectomy and interventional procedures has equal chance to have a complication. But if we examine the hypertensive crisis during the procedure, we can determine that during ablation procedures, there is a higher chance, almost 8 times higher chance to have a hypertensive crisis during ablation than during laparoscopy. Our third main outcome is the resolution of hypertension. We can determine that to this effect, that resolution of the hypertension is more common in LA and less common in RFA and eternal ablation. Our study has strengths, for example, that the included studies have similar eligibility criteria, and the included studies we examined focuses ethanol and RFA, radiofrequency ablation, and we use only comparative studies. Our limitations that we use only retrospective studies, cohort studies, and we had a low number of patients. And these articles focuses only aldosterone-producing adenomas. Our conclusion that during ablation procedures have a higher risk of hypertensive crisis and have a lower biochemical effectiveness. But it has advantages that it has shorter operation time and hospital stay, and it has a decreased perioperative blood loss. We have implication for practice that LA is the most appropriate procedure, and it remains the gold standard therapy. But ablation can be alternative therapeutic option when LA is not applicable. We have implications for research also. We need more comparative studies to examine. Mainly, we need more randomized control trials. We submitted our manuscript to the International Journal of Surgery, and it is under the revision part of the process. Our second topic is investigating the efficacy and safety of minimally invasive interventions in the treatment of low intermediate risk prostate cancer. The second most commonly diagnosed tumor in men is the prostate cancer. We focuses only the low intermediate risk prostate tumors, which are T1 and T2 stage tumors. These tumors are usually asymptomatic cancer. The first-line treatments are the radical prostatectomy or radiation therapy, which is usually external beam or brachytherapy. These procedures have many complications: erectile dysfunction, total and stress, urinary incontinence, rectal injury, wound infection, anastomotic stenosis. So we would like to think about what can be used if radical prostatectomy or radiation therapy is we don't want to use first-line treatments like this. Minimally invasive procedures, thermoablation, including cryo, radiofrequency, and microwave ablation procedures, high-intensity focused ultrasound, irreversible electroporation. And our aim is to find the most appropriate interventional procedure for the treatment of low intermediate risk prostate tumors. So our question that which interventional procedure is the safest and the most effective therapeutic option for patients with low intermediate risk prostate tumors? The PICO framework, the patients with low intermediate risk prostate tumors, and the control group and the intervention group is the minimally invasive interventions. We would like to compare each other in case of complication rate, progression-free survival, and recurrence rate. Our hypothesis that by comparing these different interventional procedures, we can determine which is the safest and most effective option in the treatment of low intermediate risk prostate tumors. We used the following search key with 4 main domains, and we conducted the search in 3 databases. After the selection process, we have 98 eligible full texts. We separated the eligible full text into 4 major groups in terms of the interventional procedure. But you can see that we have limited articles in terms of microwave, radiofrequency, ablation, and embolization. Unfortunately, we had to exclude these articles. This is my progress of the second project. We finished the full text selection, and we had 20% of the data extraction process. So we submitted the first article 10th of June, and we are planning to finish and submit our secondary project manuscript on December on this year. And I would like to close my speech with Benjamin Franklin words. Tell me and I forget, teach me and I remember, involve me and I learn. Thank you for your attention.
I have so many questions, but I take only one.
Yes.
So you mentioned thermoablation.
Yes.
And embolization as well. And we use embolization in fibrate therapies in gynecology. What's your experience? After this procedure, can the adrenal tumor disappear totally or remain some rest of the tumors in a later time? Because fibrate is getting smaller, but it's not disappearing.
Yeah, after the thermoablation and embolization, usually the tumor is getting smaller. We call it remnant tumor, but in most cases it doesn't disappear.
And one more about the thermoablation. Yes. Is it a safe procedure?
Yes, it is. Nowadays it is safe, but the most common complication is the hypertensive crisis, and there are many defending techniques in the guideline. Before the treatment, they get alpha blockers before the procedure, and it can reduce the chances of hypertensive crisis during the procedure. But nowadays, it's a safe procedure.